This is Megan Mitchell with Agents of Change Social Work Test Prep, and today I'm going to give a brief overview that is a question asked very frequently by test takers, and that is, what is the difference between the master's level and the clinical level ASWB exam? We get this question multiple times a week. Every state has different requirements, so we're going to give a brief overview. I do want to preface this, though, by make sure you are checking with your state licensing board for social work to determine what level of exam you need to take and what level of exam you are eligible to sit for. So who takes each exam? Here's just some stats. It's actually pretty equal amongst who's taking the master's versus clinical each year. Like I said, I preface this by saying this is a state-by-state basis. Some states require both a master's level and a clinical exam. Some states only require the clinical level exam. In most states, a majority of the states, you often need to take the master's level, that's the first level after getting your master's degree in social work, to get a master's level license. I started out in Washington, D.C. I took the master's level exam, and then I got an lcsw license, licensed graduate social worker. I got my clinical hours. I put in my years of supervised experience, and then I was eligible to sit for the clinical exam years after that. So the clinical exam was the higher level of exam, higher level of licensure. I sat for that exam, and then once I passed that, I was given the licensed independent clinical social worker license. The different letters that you will see associated with exam also vary by state, so make sure you're checking with your state for what each level is referred to as. The master's exam, often you might hear it as lmsw, lgsw, cmsw, or csw. Like I said, that varies state to state. Most states require the master's exam as the post-MSW entry-level exam. Then there is the clinical level exam. This is the highest level of licensure for social work. About 20,000 social workers each year take it. And this is generally the highest level of licensure, and it's a prerequisite for independent clinical services. Oftentimes people doing this will bill for insurance. They might be in private practice, and they are often being paid for therapeutic services. And if you are fully licensed at the clinical level, you also can supervise other social workers. Licensed social workers who pass the exam, have their supervision hours, have everything required at the highest level for the clinical licensure, often receive the designation of LCSW, LICSW, LISW. Every state is different, okay? So master's level is usually the first level exam. You have to acquire your supervision. You have to wait a certain amount of years. Then you are eligible to sit for the clinical exam. I preface this by saying, once again, check with your board, check with your state, because some states do not require the master's level, and you can sit for the clinical level exam after acquiring your supervision hours. Okay, what is similar between these two exams? The way that exam is structured, set up logistically, is the same. You will have 4 hours to complete it unless you have an accommodation, and it will consist of 170 total questions. At the time that I am recording this information, we are in 2025. This may change in the future, but this is how the test is set up as of 2025 ASWB testing standards. There is some topic overlap. I say this, the content is the same no matter what level. You don't change theories, you don't have a new code of ethics. The content is the same. I always say the theories are the same, the code of ethics is the same between both levels. However, the difficulty of questions changes, and the distribution of questions in each section changes. So human development, diversity, and behavior in the environment are on both exams. Assessment and intervention planning is on both exams in some way, shape, or form. And then professional relationships, values, and ethics is also on both exams. Here's a breakdown. I'm not going to go super in depth, but you can look here of what is the difference. On the left is the master's exam and the breakdown of the 4 sections. So 27% of the exam will be human development, diversity, and behavior. 25% will be professional relationships and ethics. 24% assessment and intervention planning, and then 24% interventions with clients and client systems. You can see what that approximately breaks down to question-wise. The clinical exam has a little bit of distribution change. So it's going to have the heaviest emphasis on assessment, diagnosis, and treatment planning, 50 to 50 questions, about 30%. 27% is psychotherapy, clinical interventions, and case management. 24% is human development, diversity, and behavior in the environment. And then 19% is professional values and ethics. You could make a comparison here. There's about 10 to 15 sway or change between the different domains between the master's level and clinical level. If you have content that you studied from your master's level, as long as it's up to date and it's still in line with any changes that have been made, so as long as it's not outdated, it's still in line with the current DSM, you can still use that content. Like I said, Code of Ethics does not change, it updates, but it's the same document that you will be reading. Certain theories, Erickson, defense mechanisms, medications, those are the same between the 2 levels. How difficult is each exam and what are the outcomes? The master's level is going to be difficulty-wise not as difficult as the clinical because it's more of an entry level, master's level, intermediate exam. So people that have just finished the master's in social work degree, usually right out of college, are testing for this level. It is the entry level for master's level. The clinical level is the highest level, that's more advanced, and it's going to focus more in on clinical expertise. So you might see more diagnostic questions, you might see more case vignettes, you might see more therapeutic questions there. What does this lead to? The master's level in most states, you usually can get licensed at this level, but you will need to practice under supervision. It varies depending on state, and there's often a certain amount of supervision hours or length of time. It's generally thousands, 2,000, 3,000. It depends on where you're practicing at, but that does have to be under someone that is fully licensed, and that can be in some cases a psychiatrist or psychologist or LCSW. Always check with your board. Every state is different. When you sit for the clinical and you get licensed, this is generally considered the highest level of licensure, and this assumes that you can practice independently. You would not need supervision to practice, to bill, to provide services to clients at the clinical because it's the highest level of licensure. How should you prepare for each exam? It should not differ in how you prepare. The strong test-taking strategies that you have, the study skills that you have are going to apply to both levels. It's just the what you will see on the master's is more generalist. What you see on the clinical is more, it's definitely more clinically focused, obviously, and it's going to be more focused on psychotherapy. Okay. The master's exam is more generalist. You have to know the concepts, you have to know the foundation, and you have to have a wide range of understanding different settings, because the assumption is you could practice in many different settings. So you need to know community-based social work. You need to know micro, meso, macro. You should definitely have a strong foundational knowledge for the master's level exam. Research actually shows that the closer you take the master's level exam to graduating, the better prepared you will be, because you are, first of all, already in the mindset of being a student, and sometimes that knowledge is more fresh. How do you study for the clinical? You still need all of the same skills and information you need for the master, but you should be focusing in on DSM diagnostic, You should be focusing in on clinical techniques, supervision questions, because the assumption is you would be practicing as a supervisor or independently. You might be tested more on medications, psychotherapy concepts. Both you want to use practice tests. That is the best way to prepare on top of knowing what you need to know for the foundations of the knowledge. You practice exams help you in real time assess your readiness, and that's going to be an indicator of how ready you are to sit for the exam. What do people do with their license after each of these different levels? So after you pass the master's level exam, you generally can be in a variety of different roles, but knowing you probably will have to be under a licensed clinical social worker or some sort of highest level independenture mental health professional. The clinical exam is going to be most for people that want to go into clinical practice. Maybe you want to own or work in a private practice. Maybe you want to bill services for insurance in that type of therapeutic setting. However, there are a vast amount of things that you can do, and each job is going to depend on what your role is, where you are geographically. For example, I was a school social worker where I worked when I was in the public school system. You were not eligible for a school social work job unless you were fully clinically licensed. However, there were charter schools within where I was located where you only needed the master's level because they had a supervisor that would be able to provide that supervision for you. Always ask and always check when you're applying to jobs or when you are figuring out what level of licensure you need for your state. People always say, should I go for the master's? Should I go for the clinical? This is definitely up to you. I encourage it. I think that licensure opens a lot of doors. Why do we have licensure? Because it is there to protect ourselves as the providers, as the social workers, and to protect our clients, right? We need to have some oversight. We need to have some level of expectations that are held across the profession. So this is the way that the social work profession does that. So what biggest takeaway you can take from this is there a huge difference in content between the master's and clinical? No. However, you should be prepared when you're taking the clinical to have more reasoning and those higher level problem solving questions. You need to be thinking at a high level. The difficulty is going to be higher than that of the master's. So content is the same between both levels. What you will see on the exam varies as you'll get more generalist questions. So be prepared for lots of different types of settings on the master's level. The clinical level is going to be more client focused, more psychotherapy focused, and more diagnostic and DSM focused. We have content for all of those different levels. What we suggest if you are sitting for the clinical is you're able to really dive into case vignettes where you are given a clinical case. You're able to pull out the important information. You can assess and you can diagnose based on the information given to you. Master's level, what people always trips them up that I often hear is they sometimes are not well prepared for the macro or meso level questions. So this might be community organizing or program development and policy development. So make sure whatever area is not a strength of yours, no matter what level of the exam you're sitting for, you go through the knowledge, skills, and abilities that are put out by the ASWB, and you are prepared for what you may see on those two different levels of the exam. Also note that some people report different ways that they felt that the exam went. Some people felt that the master's level was more difficult for them. Some people felt that the clinical was more difficult for them. I think it really depends on the person, but you should not be changing your study behaviors between the levels. What you should be doing is focusing in based on those percentages that you're going to see on the master's versus the clinical. So it's just kind of changing the lens through which we are going to study, not changing your content. We have all of this for you on Agents of Change. If you need more content, we have something for everyone, every level of the exam. You can check us out at agentsofchangeprep.com. If you're taking the clinical, we do have a clinical package that has more in-depth clinical materials, so you might want to check that out as well. We also have study groups for those that are members of our paid community, and we go over different questions, master's and clinical level questions at times throughout the year for those as well. If you have any questions, please contact us at agentsofchangeprep.com, and we would be happy to help you. Always check the ASWB website for more information. We try to keep you as updated as possible, and always check with your state to make sure that you have the most accurate, up-to-date information, because every state is different. So thank you for tuning in, and I hope that you will utilize the Agents of Change materials in your studying. Thank you, everyone.